Hi everyone, it's USM 2019. My name is Heather Capozella and I'm a third year PT student at the University of the Incarnate Word. I was first introduced to this activity of finding pain in artwork by Dr. Brown in my spring semester of my first year at the University of the Incarnate Word. I initially was a little daunted by this activity. I thought it was really interesting, but it was a little scary trying to find a piece of artwork that expressed pain. I had known of artists such as Frida Kahlo, who expressed a lot of her pain through her paintings, but the thing that's really rather more uncomfortable and frightening about this activity was finding something that you react to and that you want other people to react to as well. But art is such a personal thing, and everybody reacts to it and feels differently about it, and feels differently about different types of art and medium, and maybe interprets an art form differently than you do. And so it felt a little vulnerable trying to find something and expressing something that I reacted to, and that it's expressing something that is very personal to another human being as well. Once I got past that initial gut reaction of being a little afraid of being vulnerable, my classmates and I think, all had a really interesting experience with this and were really affected by it and think about it even to this day. Even if we don't think about it all the time, we still it still affects the way we see our patients and approach our patients as well. My initial approach to trying to find an artist and artwork was by searching catalogs of artists that I had known before, that I really enjoyed their artwork and that their artwork had spoken to me, such as Rodin and his sculptures. I didn't have much luck there. I went back to catalogs of different artists and museums that I had been to and found art. I eventually found an NPR story about an artist who was expressing his pain and his experience with his condition of sickle cell anemia, and chose his artwork in the end. The reason I chose it was because I didn't realize that sickle cell anemia was such a physically debilitating disease, and the fact that it can cause blindness. It caused him physical pain many times due to blood clotting and a lot of other secondary effects of sickle cell anemia, but also that it was really emotionally painful for him as well, especially growing up. He wasn't able to participate in sports activities like his peers was, and wasn't able to play with his peers the way he saw them running around in the street, and it was really difficult for him, and I didn't have the understanding or appreciation before. I think a lot of my classmates came away from this experience with the same sort of initial reactions and feelings, as well as pain doesn't always express and manifest itself physically. There's not always a wound. People don't always show it on their faces that they're in pain, with the expectation of trying to function in society, or even in today, where we on Facebook and social media always show that we're happy and healthy. And so it's a really difficult thing that a lot of people hide, and art is a way that a lot of people can express that pain. I think it was really valuable for us to have a better understanding that pain is also very personal. Everyone expressed their pain in a variety of different ways. The artist I chose did it through paintings, but a lot of people also chose songs that were very personal to them growing up, or were very personal to the artist, as well as even sculptures. And some sculptures were, I definitely remember, being very frightening and very almost grotesque. And it's something that is difficult to see. And giving our patients that space to express themselves is so important. And I think that was a big message that a lot of us got from this. I think it's something that I'll take with me into the future as I treat my patients, giving them the space to express themselves and to talk about their experience. Pain is very personal, as I said before, and I think that having a better understanding of a patient's pain and the way that they want to express themselves in a manner that they're able to express themselves is really important, and helps give us a common language and a way to discuss things. And I think that's really important for us as physicians and students. Thank you for your time, and I hope you enjoy the rest of the presentation.